Welcome to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna. Human history is filled with a lot of stories of great heroes. Heroes are those that inspire the others. And when we think of heroes, we think of people in the past, stories filled with great bravery, where they overcome adversity to succeed. But quintessentially, when we think of heroes, we generally think of warriors or conquerors. But did you know that the word hero comes from a Proto-Indo-European word, which actually means to serve and to protect? And in radiology, who do we call heroes? Who do we think are the bravest of us, who are willing to overcome adversity? Who do we think are the ones who inspire us to be better in every single way? We have with us not one, but two heroes today for you. What is their story? What do they do? Why do we call them heroes? I present to you Dr. Nasir Jaffer and Korosh Khalili. They are initiatives in which they extended their reach, not just in their immediate surroundings, but they wanted to make the world a better place for everybody. To listen to this inspirational story, continue. Nasir and Korosh, it's a great pleasure to have you here.
Thank you.
Thank you.
So Korosh, let's start with you. I have heard this story quite a few times now, but for the sake of audience, can you tell me your story as to how you got involved in expanding radiology beyond the borders of Canada and how you were able to serve a lot of underserved countries and improve radiology in the rest of the developing world?
Thanks very much, Satish. I'd like to first start by saying that I'm not sure that the word hero really applies to me. What inspired me was really people in our own department and around the city of Toronto who were in the field of radiology and beyond. And we're doing some international development type work. And so the person that I knew most of was Nasir. Nasir had been, ever since I knew him, had been involved in international development work. And that got me interested in that as well. Around that time of about 10 years, I started getting the 10-year itch of an academic radiologist. I think that's why they have sabbaticals around 10 years or so. And so I was thinking that I'm feeling relatively comfortable in my work environment. I'm doing some teaching, which I love. I'm seeing some, nice diseases. I'm helping some patients and helping some clinicians. We were a doctor's doctor. I was feeling I was too comfortable and wanted to do something that was a little more of a challenge and something different in my life. And that kind of coincided to a certain degree with my personal life as well, because around those years, I met my future wife. And, after about, when we became about serious and we decided that we're going to get married, around that time, I kind of confided in my wife that I was thinking of doing some, international development type work. And, when we're getting married, why not combine our honeymoon and this kind of work together and do some volunteering overseas?
So you decided to spend your honeymoon improving radiology across the world rather than enjoy a personal life.
So the idea was that we're going to do some volunteer work, and we'll see, we'll learn about each other and learn about the world at the same time, and do some good. We decided that we're going to spend 3 months in a country and then move on to another endeavor. And I knew for sure I wanted to spend about 3 months in South America. So I had a friend of mine who was a radiologist in Chile. I contacted him, and he put me in contact radiologists in Peru, Bolivia, And in Chile as well, I did a quick trip, visited 3 different hospitals in these countries, and settled on going to Peru. And then for Africa, I went to the head of the department and said, "Do you know anybody in Africa?" He had worked in Africa before. And he said, yesterday there was a group of people from University of Toronto, or affiliated University of Toronto, who are looking for somebody to help with the radiology program in Ethiopia. Wonderful, just sign me up. And so
It's almost like destiny in which they were searching for you and there you were ready to go.
it was really, it was really lucky for me. So, and then I had friends in Korea. So the idea was we're gonna, go and spend some time in Korea, and that was the part where I was gonna learn a lot more radiology than maybe, than give, and we were going to go somewhere in Asia as well beyond that. Yeah. So then, we had our as the wedding was coming up, I started planning our time after the wedding, and my wife spent all the hard work of actually planning the wedding. Yeah, and so we decided we're gonna have to raise some money, and so we were gonna ask for instead of gifts, some donations.
Yeah, that was the part I was very interested in when knowing, because from what I hear, you said that you don't want gifts, but give monetary gifts instead.
Yeah, in lieu of gifts, just whatever you can. We set up an account with within the foundation at Toronto General, Toronto Western Hospital Foundations.
Also was done within the Toronto General Hospital.
Absolutely.
Amazing.
The TGHWH Foundation at that time, now it's called UHN Foundation. They're just lovely group of people. They helped us set up an account.
How much did you end up raising?
So in that process, we ended up raising about $37,000.
Wow, okay.
Which was incredible.
This is like more than 10 years ago, roughly, yeah.
Absolutely. It was in, our wedding was in 2011. So we got a portable ultrasound machine, and we had our money, and we had a plan to go 3 months to Peru, 3 months to Ethiopia, and then, we're in the process of arranging, Korea. The issue we had with Peru was language. So,
I was going to ask that. I was like, did you know Spanish?
No, my Spanish was
This is where the adversity comes in. Like, first you got to convince your wife to spend the honeymoon, not in Peru, because Peru is a beautiful place, but you want to spend it in the hospitals of Peru, which is a whole different thing. And then you have this issue of where do you get all the money from to do the good? And then you manage to get that. You buy all these ultrasound equipment to take there, and then you don't even speak the same language. So this is the true definition of overcoming adversity to do some good in the world.
Thanks very much. It could be foolhardiness. And very quickly I learned that English is not widely spoken in Lima,
And this is prior to the era of Google Translate or anything, but now, because I was in Peru last week, and for the most part I was comfortable because I had Google Translate, I could just translate. But like 2011 is just when smartphones were just coming up. So wow, that's incredible.
I landed there and went to the public hospital, and we decided to give a series of talks. And so one of the residents was, had wonderful English skills, and she was going to be my translator. I tested the whole group of, the entire residency group and some of the staff who were attending. I gave them a little exam before I gave the talks. And then I gave them the same exam after I gave the talks. And, just to kind of measure the impact that I had made after, these. And I'm very sad to tell you that really, from a statistical point of view, there was only one person whose performance on the tests really significantly improved. And that was my translator. So, it was not highly impactful.
In terms of statistics, maybe, but in terms of inspiring stories and potentially down the line, how they viewed radiology, significantly things can be changed, and tests are a poor measuring sticks anyways.
Well, people who I was a student of Nasir's at one point, and he can tell you that I'm not a good student. I learn things by doing it, by making the mistakes rather than listening to somebody's experience. I'm sure that will be his experience teaching me. And so had I talked to Nasir and sat down and say, listen, Nasir, I'm going here, what method of teaching really works? If you're in an environment, for example, that there's a language barrier and whatnot. And, I would have learned how would have to improve these 3 months. But, I learned the hard way that this doesn't really help that much. It was very kind of limited local impact. But that really helped me with the next destination I was going to. The next destination I was going to be Ethiopia. But meanwhile, in Peru, my wife started being very violently sick, and we thought that she might have pneumonia. And we went to a hospital, for her to have all sorts of investigations, and they also did a pregnancy test, and there was this source of her illness. She very bravely told me to go to Ethiopia, and she went back to Toronto after our time was done in Peru. And I went to Ethiopia for the next 3 months.
Hold on. Let me get this straight. So you get her to plan the entire wedding. You say she gets no gifts, and all monetary gifts go into developing. And you plan the honeymoon, which is to be in hospitals in Peru and Ethiopia. And then in the middle of your honeymoon, you send her back home and continue with the honeymoon just by yourself.
Well, I would say that the rest of it wasn't a honeymoon per se, but it had we had given a commitment, so we decided that we had raised this money, we were going to do the good, and so very unselfishly, my wife kind of pushed me to continue with the program.
That's amazing that you have incredible people around you who kind of push you to be great.
Yeah, so the heroes are really not necessarily the protagonists, but are all the people who got me the machines and got the idea for the fundraising and how to improve on it, and their locations were to going, how to make it very effective, and my wife, so yes.
And the people who inspired you, and you're a hero because you're inspiring countless generation of radiologists. But as you point out, the heroes are the supporting cast around you and the people who inspired you. And one of the OGs, the originals, is Nasir. I've listened to numerous stories. I wasn't trained by Nasir, but I've listened to numerous stories of trainees under Nasir who all have one thing to say. Oh, I was inspired to become a radiologist because of Nasir. For all our viewers, you would have listened to the podcast by Kate Hanneman, who currently is the superstar in radiology. And she was inspired to be a radiologist by Dr. Nasir Jaffer. So Nasir, what's your story? Because I think that before everything, you were involved in outreach. And at the end of the day, it takes a special kind of person that you're comfortable in Canada, but you still want to serve countries which actually need to be set up. So if I understand correctly, you helped set up a lot of the radiology programs abroad in Karachi and a lot of other places. What's your story there?
Really, my international work stems from my faith. Actually, it's we are told to serve the marginalized people around the world, and in our community we have the Aga Khan Development Network that is lots of programs around the world, agencies rather. One of them is health, and they've built all kinds of dispensaries, hospitals, universities around the world, and we've been asked to share our time and knowledge as time goes on. Not just to sit and earn money, but also share your knowledge. And I started in '93 when the university in Karachi just opened, and they asked us to visit and help with the radiology program and help set up the international program. So I helped them set up the program there, and I went for 4 years in a row, 1 month at a time. And thanks to the department, they actually let me go for a whole month. And they still paid me for it, actually, to go and spend a month each during the winter time. And then small hospitals like in Dar es Salaam, Tanzania, where I'm from, and I think that's where
In Tanzania?
Yeah. Okay. So that's where my passion lies. Africa is my passion because I was born there, and I needed to give back to that country after. So I set up the program there, the internship program there. Then I was invited to the University in Nairobi, which had just opened again.
So this is Nairobi's in Kenya then?
Nairobi, Kenya.
Wow, so you've been involved in a lot of countries.
Yes, yes. Because of our institutions, they are all over the world, mostly in developing countries. So wherever there's a health institution, I would be invited, or I would go there, volunteer my services. So in Nairobi, we were asked to help the program, the CT sonography program, the internship program, and also their residency program. So I went to teach for 3 years, and invited me to be an external examiner for 3 years for their residency program.
Okay.
So those are some of it's basic work and also some academic work helping develop programs.
That is incredible. Like, you helped set up and start some of these programs in many parts of the world. And I guess back in the 90s, radiology was kind of like a budding specialty, just setting on spark. And I think that you provided the spark in these countries so that now they've developed into full-fledged programs. Are you still in touch with them?
Yes, I'm still involved with many of them, actually. Dar es Salaam, Kenya. I helped set up virtual teaching between our radiologists here, Dilkash Kajal, and the fetal radiologist there. He gave certain sessions to them virtually. Also in Tajikistan, I think Korosh went to Tajikistan, he can attest to it, the kind of health delivery that's there. So the radiology program is very basic. So the last 4 years, I've been teaching virtually, setting up the program, teaching the clinicians and the radiologists and how to interpret studies. And 2 years ago, I was invited to go to northern areas of Pakistan. Now there, I was involved in work that I never do, actually, ultrasound. But I was asked to help train the lady health visitors, which are called midwives, to help them train or retrain upgrade their skills, rather. So I went to assess their skills. Thankfully, Dilkash again helped me with some of the concepts, how to set up a program, how to teach, or how to assess but there were radiologists already there with whom I worked. They are the ones who did the teaching, and I just helped them create the program of training those lady health visitors. So in 2 years in a row, and in fact, we have a meeting this Saturday to discuss how do we upgrade more. So we involve more radiologists from northern areas in Karachi, Pakistan, to take the program to a higher level where they will train all the lady health visitors to provide high care, almost tertiary care, antenatal ultrasounds. Because there were problems with their ultrasound. They did ultrasound, but they never recorded the images. And what would happen is sometimes if there was an anomaly or if there was a problem with the pregnancy, they refer the patient to a central area like Gilgit, maybe Karachi, and sometimes the diagnosis was wrong, or sometimes it was too late to do anything after that. So now we're trying to upgrade their skills so they could provide or do better ultrasound, so they could refer quicker or later. So we're trying to do that learning. And recently I was invited to go to Afghanistan, actually, Kabul.
Oh, wow, okay.
So we went under the umbrella of the Arkan Development Network. And that particular hospital is called the French Medical Institute of Mothers and Children. It was developed by a French NGO in 2002. And then the French government and the Arkan Development Network took over and they expanded to a 180-bed hospital. And now they provide tertiary care. They do plastic surgery, they do neurosurgery, pediatric surgery. And the radiologists, they have 2 MRI scanners, 4 ultrasounds, 2 CT scanners, and they have a robust radiology program. So they asked me to go and assess them. And I found that the residents were very bright, very willing to learn. And I actually gave them 4 exams, 2 OSCEs and 2 other exams, and they scored really high. I was so surprised that they scored so high. And I was also invited to teach the medical students at the Kabul Medical School. And there too, I gave them a interactive exam type case-based session, and they were flying with the answers, and they all spoke great English.
So medicine ultimately is about diagnosis and treatment. And what you have done is you've set up good quality diagnosis. You have improved the quality of the radiologist, improved the quality of diagnosis. And once you have a good quality diagnosis, then automatically it also inspires the other specialties to kind of catch up and treat those diseases. So it's not just improving radiologists, you've just impacted healthcare in all these countries in a big way. And the way I look at it is that there are two kinds of people in the world: people who, either complain or just say that, oh, we need to increase exposure or increase, we need to complain to the government. And then there are people who just roll their sleeves and get the work done. And you two are prime examples of that. So Nasir, one of the things I wanted to ask you specifically is that what Korosh was alluding to, and you are visionary in terms of education. You have set up many different ways in which to educate people, and you've actually taken a session on how to give good education, especially in these countries. One, when there is difficulty with languages. Secondly, when there is difficulty in terms of logistics, limited resources. For example, in Canada, we can always get a repeat CT or an MRI in 6 months. Many of these countries, it might not be possible. Is there a difference in how you educate people here versus abroad? Is there something we need to keep in mind when we are trying to do something like you, when we're trying to improve radiology in the rest of the world?
I guess in Canada, I guess it's very patient-centered care. So I try to educate the residents and my colleagues to sort of have patient in front of you. So when you're reading or when you're reading a CT or whatever, you have the patient there. He almost is listening to you as you're reporting the case. So like when I do my GI studies, I actually bring the patient in, so let's look at the study together. And then I make the diagnosis with them. I say, here's the diagnosis. So they understand when they leave. Now in the countries where I've gone, sometimes it's very hard to do because of, as Korosh mentions, the language barrier. So I am lucky that I was able to speak Swahili in Africa, in Kenya too. So it was easy because I grew up with that language. But in northern areas of Pakistan, where the language is different, in fact, northern areas have about 15 different dialects within one city. So when you see patients coming in, you cannot talk to them. In fact, the radiologist who helped teach the midwives in one of the smaller towns, he too also has a translator with him when he's doing patients on a regular basis. So the language barrier is very, very important. And I think one of the things that when I went to Afghanistan, even though they spoke English, the dialogue, the simple greeting language, I did not understand. So I tried to learn it. In fact, I'm thinking about when I go back next time, I learn the language before I get there. So learning the language, as Korosh mentions, is very crucial. Okay. Before you go there, get yourself ready. So when you go there, you have at least basic knowledge of simple greetings, so they come to respect you. So whenever even if you speak in English, you have a translator, but that greeting, the pleasant greeting, will get you respect in that country.
That's amazing. They learn radiology from you, and you learn their language, their way of life, and it's mutually enriching. Korosh, what did you think you learned from this entire experience, not just for yourself, and what can you tell people who want to follow in your footsteps? And there are thousands and millions of radiologists who just want to be like you. What can you tell them?
Well, I would say don't be pig-headed like me. Listen to the people who have done these things beforehand, your local leaders, and try to get into established programs. I would say that setting things up by yourself is a lot more difficult and requires a lot more experience on many different levels, including the administrative levels and the political area and the cultural. Is just far beyond what we know best, which is radiology. So I think that if you try to get in a program that is already established, it really does help. What I would do though is make sure that you kind of have some kind of a metric to see the effectiveness of that program, because there are a lot of ways for you to donate your time and donate your goodwill and money. And I think you want to make sure that, that program that you're kind of signing up yourself for, has a proven track record, that there is some kind of a metric that, you can look at. I want to go back to what Nasir was also saying with regards to patient-centered care. The kind of patient-centered care that I try to practice really stems from my training with Nasir and a number of other radiologists in our department that, really, have conversations with the patients and kind of help, guide them, direct them, console them, educate them. And so, people like Nasir, who I spent my first full year in residency with Nasir, and also, people like Mustafa Atri, Stephanie Wilson. These are just, and there are a lot of wonderful other people that I'm sure I just forget to say their names, but just, that bring that idea of direct patient contact into our field, and that kind of makes our work a lot more meaningful.
That's amazing. And Nasir, how you have inspired countless radiologists already. And many of the established radiologists, it has a ripple effect in which now they are inspiring people after that. How do you continue to do that? And how would you also inspire people to not just be satisfied within improving radiology within their local area, but also have the global outreach like you have had?
I think the inspiration comes because I had lack of knowledge, lack of mentorship early on, and I thought that lack of mentorship made me push a little quicker, faster. I had to fight my way out, and I think by allowing others to bring the potential out, bring their own potential out, is where the mentorship begins. Really, it's not you mentoring them, but you inspire them to come out and show their strength. That's how I believe that the radiologist becomes a radiologist.
That's inspirational. You aren't trying to drag the talent out of people, but you just want to inspire them to break out of their own shell and come out with flying colors. Ladies and gentlemen, you've heard incredible stories of bravery, stories of how they overcame adversity to do good in the world. And a lot of time, we always think that one of the things we need to do as humans is to give back, to do philanthropy. And often, these days, it has devolved into giving money for charity, for certain causes, for saving turtles or dolphins. But the word philanthropy actually comes from two words, philos and anthropos, meaning philos is love, anthropos is humanity. It is literally loving people, loving your world you live in, loving everybody in the world and wanting everybody to be in a better place. Ladies and gentlemen, that was Drs. Nasir Jaffer and Korosh Khalili, and me, your host, Satish Krishna. See you on the next one.